Today's video topic is indications for colonoscopy. So colonoscopy, colon-scopy. Colon means large intestine, scopy means to view inside. So what are the indications? When your doctor says we need to do a colonoscopy, he must having some idea for why we are doing it, and you should also know why the doctor is asking for a colonoscopy. So the indications we can broadly classify into three things. One is diagnostic, so diagnose any disease; therapeutic, as a part of treatment; and surveillance, it's like monitoring. So as a diagnostic, the first thing is always any lower GI bleeding, lower gastrointestinal bleeding. So either it's from the right side colon, transverse colon, or the rectum. So probably that is the first indication we generally. Then unexplained weight loss. Suppose you have unexplained weight loss, so your doctor may ask for a colonoscopy. And severe constipation, extreme constipations in any age, young age or even old age. If you have an extreme constipation, they may ask for a colonoscopy. And diarrhea, again, suppose unexplained, 10 times, 15 times you pass motion, and we want to know, the reason. Then they ask for a colonoscopy. Other indication, probably if the doctor suspects a growth or a tumor in the colon, either in the rectum or the sigmoid colon or right side colon, left side colon. Suppose any suspected cancer, so they may ask for as a diagnosis. Or suppose you've gone for some other investigation like a CT abdomen, and radiologically that shows some abnormality, so he may ask for a colonoscopy. These are the main thing. The other things are like inflammatory bowel disease, IBD. Suppose you have a Crohn's disease, Ulcerative Colitis, so they will go to see and diagnose. And other things are all like, suppose you have a TB infection or any other bleeding reason, so polyps. So polyps, we all know, one of the very common cause for bleeding. So to diagnose polyps also, the surgeon or the gastroenterologist asks for a colonoscopy. Then therapeutic. Therapeutic comes as actually, again, suppose there is a bleeding, lower gastrointestinal bleeding, and the bleeding is from a polyp. So we can snare the polyp, or we can clip the polyp, or we can cut the polyp. Or if it's a hematomas, it's some abnormal blood vessel, it's bleeding, so we can clip or the bleeding, or you can ablate the bleeding. Or even suppose when you do a regular colonoscopy, we found a polyp, a single polyp, or one or two polyps, we can do a polypectomy. So it's a treatment. So one polyp you remove completely, so it's like a treatment. So or even one area, 2-3 polyps, you can do all the polypectomy. So polypectomy is one of the treatment part. Or sometimes we have to decompress the large colon in case of toxic megacolon, or sometimes some obstruction. There are certain indications, not for everyone. There also we can use to decompress the we call it Ogilvie syndrome. So to decompress the large colon, as a therapeutic we can do a colonoscopy. Or suppose there is an obstruction because of a tumor. Suppose you have a cancer, and there is only a small area through which only your motion is coming, and there is obstruction. We can put a stent and dilate that area so that the motion comes freely, so that we can decompress the colon part. Once the obstruction or the decompression is done, we have time to do other investigations and prepare the patient for the surgery. So this is also like a part of the treatment. So these are the things. And coming to the other part is foreign body removal. Children or even adult foreign body. Suppose any foreign body, if possible, that can be retrieved by the colonoscopy. The other indication, as I said, from the diagnostic, then therapeutic, and surveillance. That's monitoring. Suppose some patient has undergone polypectomy, bleeding polypectomy or any polypectomy. So we can do a repeat colonoscopy, or under surveillance we can recheck whether it's coming back or how the prognosis of the patient. Otherwise, the other surveillance indication is, suppose the patient has undergone any bowel resection, large bowel is resected and anastomosed. So to see the anastomotic site, whether it's going for any stricture or bleeding or any perforation, all these things we have to do a colonoscopy, and we can keep the patient under surveillance. Or if the patient has undergone any cancer, malignant surgery, rectum or colon, when we do a surgery, we can look that particular site for any recurrence of the tumor or any stricture. These are the recurrence. Usually if it is a cancer, the doctors will say, okay, after 6 months we have to do a colonoscopy. Then we do a 1 year, or after 2 years, they will decide upon the patient's condition and cancer or the indication. These are the surveillance. Or even patients who have a familial adenomatous polyposis, FAP, these in the small age group, the children will get polyps. So these children may need a surveillance of the colonoscopy to detect whether it's transforming into cancer or not. So these are the broad indications. There are other indications, but these are the main things we should know: diagnostic, surveillance, therapeutic and surveillance. Thank you.